Question 1. You are collecting data on a client's hand flapping, which often happens during transitions. During a 10-minute observation, you record that the client flapped their hands 15 times. What dimension of behavior does the number 15 represent? A. Duration. B. Latency. C. Frequency. D. Interresponse time, IRT. Answer C. Frequency. This question asks about a basic dimension of behavior measurement. The number 15 represents how many times the behavior occurred during the observation. Counting the number of times a behavior happens is called frequency recording. Duration would be how long each instance lasted. Latency is the time between a stimulus and the start of the behavior. IRT is the time between instances of the same behavior. When you just count the number of times something happens, you're measuring its frequency. Question 2. A child refuses to eat vegetables. When the parent puts vegetables on the plate, the child screams. Behavior. The parent removes the vegetables. Consequence. This makes the child more likely to scream when vegetables are presented in the future. This is an example of the screaming being maintained by A. Positive reinforcement. Access to parent. B. Negative reinforcement. Escape from vegetables. C. Positive punishment. Removal of vegetables. D. Automatic reinforcement. Sensory. Answer B. Negative reinforcement. Escape from vegetables. This question asks about the function of a behavior. The clue is that the behavior, screaming, occurs when an unpleasant stimulus, vegetables, is presented, and the behavior results in the removal of that unpleasant stimulus. When a behavior is strengthened because it leads to escaping or avoiding something aversive, its function is negative reinforcement. Positive reinforcement adds something pleasant. Punishment decreases behavior. Automatic reinforcement is internal. Getting away from something you don't like is a classic example of negative reinforcement. Question 3. You are teaching a client to put on a shirt using a task analysis. You prompt them through the first few steps, arms in sleeves, head through hole, but have them independently pull the shirt down, which results in access to a preferred activity. Once they master pulling the shirt down, you will require them to also independently put their head through the hole, followed by pulling the shirt down before getting reinforcement. This is an example of A. Forward chaining. B. Backward chaining. C. Total task presentation. D. Shaping. Answer B. Backward chaining. This question describes the specific method of teaching a multi-step skill. In backward chaining, you teach the steps of a task analysis starting with the last step. The therapist prompts the client through all steps leading up to the last one, and the client performs the final step independently, which directly leads to the reinforcer, often the natural completion of the task. Once the last step is mastered, you teach the second to last step, requiring the client to do the last two steps independently before reinforcement, and so on, moving backward through the chain. Forward chaining starts from the beginning. Total task presents all steps in each trial. Shaping teaches a single behavior. Teaching from the end first is the key to backward chaining. Question 4. Your supervisor asks you to collect data on head hitting using momentary time sampling with 1-minute intervals. If the client hits their head at the 30-second mark of an interval, but is not hitting at the 1-minute mark when the timer beeps, how should you record it? A. Mark the interval as occurring. B. Do not mark the interval. C. Record the duration of the hitting. D. Record the frequency of the hitting. Answer B. Do not mark the interval. This question tests your understanding of momentary time sampling. In momentary time sampling, you only record the behavior if it is occurring at the precise moment the observation interval ends. When the timer beeps, if the behavior happened earlier in the interval but had stopped by the time the interval ended, you do not mark the interval. Partial interval recording would mark it. A. Duration. C. And frequency. D are different continuous measurement methods. Checking the behavior only at the exact moment the interval concludes is momentary time sampling. Question 5. A client engages in screaming behavior. A functional assessment indicates the function is attention. Which consequence strategy would be most appropriate for extinction of this behavior? A. Provide a favorite tangible item immediately after screaming. B. Physically restrain the client until the screaming stops. C. Provide attention to the client only when they are being quiet. D. Consistently withhold all forms of attention, ignoring when the client screams. Answer. D. Consistently withhold all forms of attention, ignoring when the client screams. This question asks about implementing extinction based on a known function. Extinction involves withholding the specific reinforcer that is maintaining the behavior. If screaming is maintained by attention, putting it on extinction means consistently stopping the delivery of attention, ignoring verbal, visual, or physical reactions from others. Whenever the client screams, providing tangibles. A is for tangible function. Physical restraint. B is not extinction and may be aversive. Reinforcing quiet. C is DRO, a differential reinforcement procedure, not pure extinction. The core of attention extinction is ignoring the problem behavior. Question 6. You are teaching a client to identify shapes. You present a circle shape and say, touch circle. The client touches the circle. You immediately deliver praise. The verbal stimulus touch circle functions as the A. Reinforcer. B. Consequence. C. Behavior. Response. D. Discriminative stimulus. SDE. Answer. D. Discriminative stimulus. SDE. This question asks about the role of the instruction in a teaching trial. In ABA, a stimulus that signals that reinforcement is available for a specific behavior is called a discriminative stimulus, SDE. Your instruction, touch circle, delivered with the shapes present, cues the client that touching the circle now is likely to earn praise. Reinforcers, A, and consequences, B, happen after the behavior. The behavior, C, is the client touching the circle. The instruction is the cue that sets the occasion for the correct response. Question 7. According to the RBT Ethics Code, your most important ethical responsibility is to A. Your supervisor's instructions. B. The needs of your agency. C. The client's best interests. D. Maintaining accurate data. Answer. C. The client's best interests. This question asks about the ultimate ethical priority. While following supervisor instructions, A. Respecting agency needs, B. And collecting accurate data, D. Are all important responsibilities. The RBT Ethics Code places the client's best interests as the primary guiding principle. All decisions and actions should ultimately be aimed at promoting the client's well-being, safety, and access to effective treatment. Your ethical compass should always point towards what is best for the person you serve. Question 8. When a behavior is followed immediately by the removal of a stimulus, and as a result, the behavior happens less often in the future, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. D. Negative punishment. This question asks about a consequence that decreases behavior by removing something. The keywords are removal of a stimulus, something is taken away, and the behavior happening less often in the future, the behavior decreases. Negative punishment is when you remove something the person likes or wants. Negative, after a behavior, and it makes the behavior less likely to happen again. Punishment, for example, if a child is hitting, behavior, and you take away their favorite toy. Removal of stimulus, and hitting decreases, that's negative punishment. Question 9. You are collecting data on biting behavior. You define biting as any contact of the client's teeth on skin or clothing of self or others that leaves a mark or is reported as painful. This specific objective description is in A. Hypothesis. B. Operational definition. C. Functional assessment. D. Measurement method. Answer. B. Operational definition. This question asks about how we precisely define behavior for measurement. An operational definition is a clear, objective, and measurable description of a behavior. It specifies exactly what counts as an instance of the behavior and what does not, so that anyone observing can agree on whether it occurred. This is essential for consistent and accurate data collection. A hypothesis is a guess about function. Functional assessment is the process of determining function. Measurement method is how you collect data, frequency, duration, etc. The rule for identifying the behavior is the operational definition. Question 10. A stimulus that has acquired reinforcing properties through being paired with other reinforcers and can be exchanged for a variety of backup reinforcers is called A. Unconditioned reinforcer. B. Primary reinforcer. C. Generalized conditioned reinforcer. D. Conditioned punisher. Answer. C. Generalized conditioned reinforcer. This question asks about the technical term for stimuli like tokens or money in behavior analysis. These items are not naturally reinforcing, like food, an unconditioned/primary reinforcer, A and B. They gain their reinforcing value because they are paired with access to other items or activities the person wants. Because they can be exchanged for many different things, their value is less dependent on any single need, making them generalized. Since their value is learned, they are conditioned. Thus, they are generalized conditioned reinforcers. Conditioned punishers decrease behavior. Question 11. When reinforcing a behavior on a schedule where reinforcement is delivered after a variable, unpredictable number of responses, averaging out to a specific number, this is A. Fixed ratio, FR, schedule. B. Variable ratio, VR, schedule. C. Fixed interval, FI, schedule. D. Variable interval, VI, schedule. Answer. B. Variable ratio, VR, schedule. This question asks about a response-based reinforcement schedule that is unpredictable. A variable ratio, VR, schedule delivers reinforcement after a varying, unpredictable number of responses, but that number averages out to a specific value. Example, VR20 means reinforcement is delivered on average after every 20 responses. Variable means unpredictable. Ratio means based on the number of responses. Fixed ratio, FR, uses a fixed number. Interval schedules, phi, VI, are based on time. Unpredictable number of responses for reinforcement is VR. These schedules produce high, steady rates of behavior, like playing a slot machine, because the next response might be the reinforced one. Question 12. According to the RBT ethics code, you should only collect data. A. That shows the client is improving. B. As directed by your supervisor, accurately and objectively. C. Only when challenging behavior occurs. D. By estimating counts to save time. Answer. B. As directed by your supervisor, accurately and objectively. This question is about ethical data collection. Accurate and objective data is fundamental to ABA. You must collect data exactly as specified in the client's plan or by your supervisor, and it must be recorded honestly and objectively, based on observable facts, not personal opinions or desired outcomes. Data should reflect reality, not just progress. A. You collect data on target behaviors, both challenging and skill acquisition, as directed. C. Estimating data, D, is inaccurate and unethical. Collect data accurately and honestly, always. Question 13. A type of prompt that involves using a gesture or movement to cue the client, like pointing, without physical contact, is A. Verbal prompt. B. Physical prompt. C. Model prompt. D. Gestural prompt. Answer D. Gestural prompt. This question asks about a prompt using movement. A gestural prompt is when you use a physical movement, like pointing, nodding, or waving, to guide the client toward the correct response. Without touching them, verbal prompts use words. Physical prompts use touch. Model prompts demonstrate the behavior. Using a movement to help is a gestural prompt. Question 14. When using discrete trial training, DTT. The immediate consequence for a correct response should be A. An error correction procedure. B. No consequence. Move to the next trial. C. Delivery of reinforcement. D. Repeating the instruction. Answer C. Delivery of reinforcement. This question asks about the consequence for a correct response in DTT. In DTT, when the client performs the target behavior correctly, or correctly with a planned prompt, the therapist immediately delivers reinforcement. This strengthens the connection between the SD and the correct response. Error correction, A, is for incorrect responses. No consequence, B, or repeating the instruction, D, would not reinforce the correct behavior. Reinforcement is delivered promptly after a correct response. Question 15. A client exhibits aggressive behavior that is maintained by escape from demands. An appropriate intervention could involve A. Providing attention immediately following aggression. B. Delivering a preferred tangible item immediately following aggression. C. Reinforcing the client for engaging in a behavior that is physically incompatible with aggression, example, hands in pockets. D. Allowing the client a brief break from demands contingent on aggressive behavior. Answer C. Reinforcing the client for engaging in a behavior that is physically incompatible with aggression, example, hands in pockets. This question asks about an intervention strategy based on function. If aggression is for escape, reinforcing an incompatible behavior, DRI, like hands in pockets, is an option, as the client cannot be aggressive while their hands are in their pockets. This prevents the problem behavior and reinforces a different one. Providing attention, A, is for attention function. Delivering tangibles, B, is for tangible function. Allowing a break contingent on aggression, D, would reinforce the escape function of the aggression, making it more likely in the future. This is what you would test in an FA escape condition, not typically used as an intervention to decrease the behavior. Reinforcing a behavior that physically blocks the problem behavior, DRI, is a common consequence-based strategy. Question 16. A child learns to say dog when they see a picture of a dog. Later, they see a different picture of a dog and say dog, even though they weren't specifically taught to label that new picture. This is an example of A. Response discrimination. B. Stimulus generalization. C. Response generalization. D. Stimulus discrimination. Answer B. Stimulus generalization. This question describes stimulus generalization. The learned behavior, saying dog, occurred in the presence of a new, untrained stimulus, the different picture of a dog. That is similar to the original training stimulus, the first picture of a dog. The behavior generalized to a new, similar stimulus. Response discrimination and generalization are about the response itself changing. Stimulus discrimination is responding differently to different stimuli. The behavior happening with a new, similar cue is stimulus generalization. Question 17. You are collecting data on a student's sitting behavior using whole interval recording with 3-minute intervals. For an interval to be marked as sitting occurred, the student must be sitting. A. At the beginning of the 3-minute interval. B. At any point during the 3-minute interval. C. For the entire 3-minute interval. D. At the very end of the 3-minute interval. Answer C. For the entire 3-minute interval. This question tests the strict requirement of whole interval recording. In whole interval recording, you only record that the behavior occurred if it was present continuously throughout the entire duration of the observation interval. If there is any break in the behavior during the interval, You do not mark it. Partial interval records any point. B. Momentary time sampling checks only at the end. D. The behavior must fill the whole box of the interval. Question 18. According to the RBT ethics code, if a client's family offers you a large sum of money as a personal gift for your services, you should A. Graciously accept it, as it is a sign of appreciation. B. Accept it and share it with your supervisor. C. Politely decline, explaining that your ethical code prevents accepting gifts of significant value, and inform your supervisor. D. Accept it but do not tell your supervisor. Answer. C. Politely decline, explaining that your ethical code prevents accepting gifts of significant value, and inform your supervisor. This question is about ethical boundaries and gifts. The RBT ethics code advises against accepting gifts of significant value, as this can compromise professional boundaries and create conflicts of interest. You should politely but firmly decline the gift, referencing your professional ethics as the reason. It is also important to inform your supervisor about the offer. Accepting it, D, violates ethical guidelines. Maintaining professional boundaries is crucial. Question 19. A child is engaging in crying behavior. The therapist determines the function is attention. To decrease the crying using a DRO procedure, the therapist should reinforce the child if A. They cry less intensely than before. B. They ask for attention appropriately. C. They do not engage in crying for a specific interval of time. D. They engage in any behavior other than crying. Answer. C. They do not engage in crying for a specific interval of time. This question asks about implementing a DRO procedure based on function, in differential reinforcement of other behavior. The DRO reinforcement is delivered contingent on the absence of the target problem behavior, crying, during a specific time interval. Reinforcing the absence of the behavior is the defining feature of DRO. Reinforcing less intensity, A, is DRL on magnitude. Reinforcing appropriate attention seeking, B, is DRA. Reinforcing any behavior other than crying, D, is technically what you do in DRO, but the contingency is based on the absence of the problem behavior for the interval, making C the most accurate description of the contingency used. Question 20. The process of gradually reducing the level of a prompt as the learner begins to respond independently is called A. Shaping. B. Stimulus fading. C. Prompt fading. D. Generalization. Answer. C. Prompt fading. This question asks about the systematic reduction of help during teaching. Prompt fading is the procedure where you gradually reduce the amount of assistance provided by a prompt, like physical guidance, verbal hints, or models, until the learner can perform the behavior with just the natural stimulus or instruction. Shaping reinforces approximations of the behavior. Stimulus fading changes the stimulus itself. Generalization is when the behavior occurs in new situations. Slowly making the help less noticeable is prompt fading. Question 21. You are taking data on head hitting. You define head hitting as any contact of the client's hand, fist, or forearm with their head, face, or neck. During a 30-minute session, the client hits their head 10 times, each instance lasting approximately 2 seconds. You record the frequency as 10. What else should you record to give a complete picture of the behavior based on your definition? A. The function of the behavior. B. The topography of the behavior. C. The total duration of the behavior. D. The latency of the behavior. Answer. C. The total duration of the behavior. This question tests your ability to interpret an operational definition and choose appropriate measurement. Your definition mentions any contact and lasting for at least 2 seconds, indicating that both the number of instances and the length of each instance are relevant to fully describe the behavior as defined. While the count, frequency, is recorded to capture how long the behavior occurred overall, you would also need to record the duration of each instance and sum them, or use continuous duration recording. The definition describes the topography, what it looks like, but you measure dimensions like frequency and duration, function, A, and latency, D, are different aspects. Recording both frequency and duration when both are relevant to understanding the behavior provides a more complete picture. Summing the durations, 10 instances * 2 seconds / instance equals 20 seconds total duration, adds valuable information beyond just the count. Question 22. Which type of verbal behavior involves responding to another person's verbal behavior, like answering a question or completing a phrase, without a nonverbal cue? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer: D. Intraverbal. This question asks about verbal behavior that is controlled by other words. An intraverbal is a verbal response that is occasioned by another person's verbal behavior, where there is no one-to-one correspondence and no visual cue. Examples include answering questions, "What color is the sky?" completing sentences, "Twinkle, twinkle little," or engaging in conversations. Mands ask for things, tacts label things, echoic repeat sounds heard. Talking about things or answering questions based on others' words is intraverbal behavior. Question 23. A motivating operation, MO, affects A. The specific form a behavior takes, topography. B. The schedule of reinforcement that is in effect. C. The effectiveness of a reinforcer and the frequency of behavior related to obtaining that reinforcer. D. Whether a stimulus is an SD or an S delta. Answer: C. The effectiveness of a reinforcer and the frequency of behavior related to obtaining that reinforcer. This question asks about the primary effect of an MO. A motivating operation, MO, is an environmental variable that changes the effectiveness of a stimulus as a reinforcer, makes you want it more or less, and influences the frequency of behaviors that have led to that reinforcer in the past. MOs happen before the behavior. They don't change the topography, A, or the reinforcement schedule, B. They can influence whether a stimulus functions as an SD by changing the value of the reinforcer, the SD signals, but they are distinct from SDs. D. MOs are about motivation and changing the power of consequences. Question 24. According to the RBT ethics code, if a client's parent asks you questions about the client's diagnosis or prognosis, you should A. Provide them with the information as you work closely with the client. B. Refer them to your supervisor, as RBTs are not qualified to discuss diagnosis or prognosis. C. Discuss it with the client's pediatrician. D. Tell them you don't know and cannot help them. Answer: B. Refer them to your supervisor, as RBTs are not qualified to discuss diagnosis or prognosis. This question is about the RBT's scope of practice and ethical communication. Discussing a client's diagnosis or prognosis is outside the RBT's scope of practice and requires the expertise of a qualified professional, typically the supervising BCBA, licensed psychologist, or physician. You must politely inform the parent that this is outside your area of expertise and refer them to your supervisor for that information. Providing information you are not qualified to give. A. Going outside the team. C. Or being dismissive. D. Are inappropriate. Know your limits and refer clinical questions appropriately. Question 25. When using a least to most prompt hierarchy, you typically start with A. The most intrusive prompt you think might be needed. B. The least intrusive prompt you think might be effective. C. Only physical prompts and fade to verbal. D. Only verbal prompts and fade to physical. Answer: B. The least intrusive prompt you think might be effective. This question asks about the starting point of a least to most prompt hierarchy. In a least to most prompt hierarchy, you start by providing the minimal amount of assistance you believe the client might need, the least intrusive prompt, like a verbal hint or gestural prompt. If the client doesn't respond correctly, you then move to the next level of help on your hierarchy, gradually increasing the intrusiveness of the prompt only as needed. This helps prevent the client from becoming overly reliant on prompts. Question 26. You are collecting data on aggressive behavior using partial interval recording with 1-minute intervals. If a student hits once for 2 seconds during a 1-minute interval, how should you record it? A. Mark the interval as containing aggression. B. Do not mark the interval. C. Record the duration of the hitting, 2 seconds. D. Record the frequency of the hitting, 1. Answer A. Mark the interval as containing aggression. This question tests your understanding of partial interval recording. In partial interval recording, you record the behavior as occurring if it happens at any point during the specified interval, no matter how brief. Since the student hit for 2 seconds within the 1-minute interval, it occurred at some point during that interval, so you mark it. Whole interval would not mark it. B. Duration. C. And frequency. D are continuous measurement methods. Any occurrence within the interval means you mark it in partial interval recording. Question 27. When teaching a complex skill like washing dishes, where each step cues the next and completing the whole sequence leads to a clean kitchen, this skill is best taught using A. Shaping. B. Discrete trial training, DTT. C. Chaining. D. Discrimination training. Answer C. Chaining. This question describes a skill made up of a series of steps that are linked together, where performing one step creates the opportunity or signal for the next step. These types of complex, multi-step skills are called chains and are best taught using chaining procedures, like forward chaining, backward chaining, or total task presentation. Shaping teaches a single new behavior. DTT is a structured teaching format, often used for discrete responses like labeling or imitating. Discrimination training teaches responding differently to different stimuli. For skills with a sequence of steps, think chaining. Question 28. According to the RBT ethics code, if a client's challenging behavior escalates and you are concerned for safety, but your supervisor is not immediately available by phone, you should A. Implement a punishment procedure you think might work. B. Continue the session as planned. C. Follow your agency's crisis management procedures, including ensuring safety and seeking necessary help. D. Leave the client to find help. Answer C. Follow your agency's crisis management procedures, including ensuring safety and seeking necessary help. This question addresses handling a safety crisis when your supervisor isn't immediately reachable. Your primary responsibility is always safety. If the behavior poses a risk, you must follow your agency's established crisis management plan, which will outline steps to ensure safety, your own and the client's, and how to obtain immediate assistance. Example, contacting other trained staff, following safety protocols. You cannot implement untrained procedures. A. Ignore the risk. B. Or abandon the client. D. Safety protocols and emergency procedures are crucial ethical requirements. Question 29. When a stimulus is presented immediately after a behavior, and as a result, the behavior occurs less often in the future, this is a form of A. Reinforcement. B. Punishment. C. Extinction. D. Stimulus control. Answer B. Punishment. This question defines the basic principle of punishment. Punishment is any consequence that follows a behavior and results in a decrease in the future likelihood of that behavior. This includes both positive punishment, adding something unpleasant, and negative punishment, removing something pleasant. Reinforcement increases behavior. Extinction decreases behavior by withholding reinforcement. Stimulus control is about cues predicting consequences. If the behavior goes down because of what happens after it, it's punishment. Question 30. You are collecting data on aggressive behavior. You measure the time from when a demand is given until the aggressive behavior begins. This is measuring the behaviors. A. duration, B. frequency. C. latency, D. interresponse time, IRT. Answer: C. latency. This question retests your understanding of latency. Latency is the time between the presentation of a stimulus, the demand being given, and the start of the behavior, the aggressive behavior beginning. Duration is how long the aggression lasts. Frequency is how many times it occurs. IRT is the time between instances of aggression. Measuring the time it takes for the behavior to start after the cue is measuring latency. Question 31. According to the RBT ethics code, you should maintain client confidentiality by A. discussing client information only with the client's parents. B. storing paper records in a secure location and using passwords for electronic records. C. talking about client cases with your coworkers in the staff lounge. D. allowing the client to access their own records whenever they ask. Answer: B. storing paper records in a secure location and using passwords for electronic records. This question is about practical steps for maintaining confidentiality. Protecting client information involves keeping physical records locked up and securing electronic records with passwords or encryption to prevent unauthorized access. Discussing info only with parents, A. is too limited. You discuss with the treatment team. Discussing in public/semi-public places, like a staff lounge, C. is a breach of confidentiality. Clients have rights to their records, but access is usually managed through the BACB or agency policy, not automatically granted just by asking. D. secure storage and access protection are key confidentiality measures. Question 32. A client often screams, behavior, when they are asked to do academic work. Antecedent. The screaming stops immediately when the therapist removes the work. Consequence. Based on this, which intervention strategy is most likely to be effective for decreasing screaming? A. provide a highly preferred tangible item contingent on screaming. B. reinforce the client for engaging in academic work. C. teach the client to ask for a break from academic work using a picture card and honor the request. D. put the screaming on extinction by ignoring it. Answer: C. teach the client to ask for a break from academic work using a picture card and honor the request. This question requires analyzing the function to determine an appropriate intervention. The ABC data strongly suggests the screaming is maintained by escape from academic work. An effective intervention for escape-maintained behavior often involves teaching a functional communication alternative, FSTA, a more appropriate way to achieve the same outcome. Teaching the client to ask for a break using a picture provides them with an alternative, appropriate behavior to escape the task. Providing tangibles, A, is for tangible function. Reinforcing academic work, B, increases that behavior but doesn't provide an alternative for escape. Ignoring screaming, D, might lead to an extinction burst and doesn't teach a replacement behavior. Teaching an alternative way to escape is often best. Question 33. You are teaching a client a new behavior. You provide a gestural prompt, but the client does not respond correctly. You then provide a partial physical prompt, and the client responds correctly. This is an example of using A. A. most to least prompt hierarchy. B. least to most prompt hierarchy. C. prompt dependency. D. stimulus fading procedure. Answer: B. least to most prompt hierarchy. This question describes a specific prompt hierarchy. You started with a less intrusive prompt, gestural, and moved to a more intrusive prompt, partial physical, because the client did not respond correctly to the less intrusive one. This is the characteristic pattern of a least most prompt hierarchy, starting with minimal help and increasing assistance as needed. Most to least starts with maximum help. Prompt dependency, C, is when the client relies on prompts. Stimulus fading, D, changes the stimulus, not the prompt. Starting small and increasing help is least to most. Question 34. Which ethical principle requires RBTs to maintain professional relationships and avoid conflicts of interest, such as dual relationships? A. Beneficence. B. Integrity. C. Fidelity. D. Justice. Answer: C. Fidelity. This question asks about the ethical principle related to trust and professional boundaries. Fidelity means being trustworthy, reliable, and maintaining professional boundaries. This includes avoiding conflicts of interest and dual relationships, where you have both a professional and a personal relationship with a client or their family. Beneficence is doing good. Integrity is honesty. Justice is fairness. Building trusting relationships while maintaining clear boundaries is practicing fidelity. Question 35. When collecting data on the total time a behavior occurs within an observation period, you are measuring A. Frequency. B. Duration. C. Latency. D. Interresponse time. IRT. Answer: B. Duration. This question retests duration measurement. Duration is the total amount of time a behavior occurs from start to finish. Frequency is the count. Latency is the time to start. IRT is the time between instances. If you are timing how long a behavior lasts, you are measuring its duration. Question 36. You are collecting data on a client's on-task behavior using partial interval recording with 2-minute intervals. The client is on task for the first 30 seconds of an interval, off task for the next minute, and back on task for the last 30 seconds. How do you record this interval? A. Mark the interval as occurring, on task. B. Do not mark the interval as occurring, on task. C. Record the total duration, 1 minute. D. Record the frequency, 2 instances. Answer: A. Mark the interval as occurring, on task. This question retests partial interval recording, this time for a desired behavior, on task. In partial interval recording, you mark the interval if the behavior occurs at any point during that interval. Since the client was on task for 30 seconds at the beginning and 30 seconds at the end within the 2-minute interval, the behavior occurred at some point during that interval. Therefore, you mark it as occurring. Whole interval would not mark it. B. Duration. C. And frequency. D. Are continuous measurements. Any occurrence within the interval means you mark it. Question 37. According to the RBT Ethics Code, if you are asked by a client's parent to provide services directly without billing the agency or involving your supervisor, you should A. Agree, as it will provide more therapy for the client. B. Decline, as this constitutes unethical practice and is outside your scope of employment and supervision. C. Agree, but inform your supervisor about the arrangement. D. Agree, but only if the parent pays you in cash. Answer: B. Decline, as this constitutes unethical practice and is outside your scope of employment and supervision. This question addresses working independently or outside of your official employment/supervision. RBTs are certified to provide services under the supervision of a BCBA and typically through an agency. Providing services directly, without agency involvement or supervisor oversight, is unethical, violates your RBT certification requirements, and exposes you and the client to significant risk. You must decline such requests and inform your supervisor. Agreeing under any circumstance. A CD is unethical. Question 38. When a reinforcer is delivered after a fixed amount of time has passed since the last reinforcement, this is a fixed ratio, FR, schedule. B. Variable ratio, VR, schedule. C. Fixed interval, FAVI, schedule. D. Variable interval, VI, schedule. Answer: C. Fixed interval, FAVI, schedule. This question asks about a time-based reinforcement schedule that is predictable. A fixed interval, thigh. Schedule delivers reinforcement for the first response that occurs after a fixed, predictable amount of time has passed since the last reinforcement example, FI 10 minutes, means the first response after exactly 10 minutes will be read for CD. Fixed means unchanging, interval means based on time. Ratio schedules, FR, VR, are based on the number of responses. Variable interval, VI, uses variable time. A fixed amount of time for reinforcement is FI. Question 39. A token economy utilizes tokens that the client earns and can exchange for various preferred items. The tokens function as A. Primary reinforcers. B. Unconditioned punishers. C. Backup reinforcers. D. Generalized conditioned reinforcers. Answer: D. Generalized conditioned reinforcers. This question retests the function of tokens. Tokens are not naturally reinforcing. Primary/unconditioned reinforcers, A. They are learned, conditioned, to be reinforcing because they are paired with things the client wants. Because they can be exchanged for a variety of different backup reinforcers. C is what the tokens buy. Their value is generalized. Thus, tokens are generalized conditioned reinforcers. Unconditioned punishers. B. Decrease behavior. Question 40. You are working with a client who engages in screaming, which is attention maintained. You implement extinction by ignoring the screaming. You observe that the screaming initially increases in frequency and intensity before starting to decrease over the next week. This temporary increase is called A. Spontaneous recovery. B. Behavioral contrast. C. Extinction burst. D. Punishment effect. Answer: C. Extinction burst. This question describes the extinction burst. It is a common and often challenging effect when extinction is first implemented. The behavior that used to get a payoff, attention, temporarily increases in rate, intensity, or duration as the client tries harder to get the reinforcement back. Spontaneous recovery, A, is the reappearance of the behavior later after it was extinguished. Behavioral contrast, B, is a change in behavior rate in one setting affecting another. Punishment, D, decreases behavior, but a burst is a temporary increase. The initial worsening of the behavior is the extinction burst. Question 41. What type of verbal behavior is occurring when a client says choo-choo after hearing a train go by? A. Manned. B. Tact. C. Echoic. D. Intraverbal. Answer: B. Tact. This question asks about a verbal behavior controlled by a nonverbal stimulus. The client is labeling something they heard, the train sound. A tact is a verbal response controlled by a nonverbal stimulus, seeing, hearing, smelling, touching something, and reinforced by generalized conditioned reinforcement, like praise. Mands ask for things. Echoics repeat sounds heard, like repeating choo-choo right after someone says choo-choo. Intraverbals are conversational. Labeling something you perceive as tacting. Question 42. You are collecting data on a student's on-task behavior. You are using whole interval recording with 5-minute intervals. Which situation would result in you marking the interval as on task? A. The student is on task for the first 30 seconds of the 5 minutes. B. The student is on task at the very end of the 5 minutes. C. The student is on task for the entire 5 minutes. D. The student is on task for a total of 3 minutes within the 5 minutes. Answer: C. The student is on task for the entire 5 minutes. This question retests whole interval recording. In whole interval recording, you only mark the interval if the target behavior occurred continuously throughout the entire duration of that interval. If the student was on task for the whole 5 minutes, you mark it. If they were off task for any part of the 5 minutes, a D, or you only checked at the end, B, which is momentary time sampling. You would not mark it in whole interval recording. The behavior must fill the whole interval. Question 43. Which ethical principle requires RBTs to advocate for and ensure equitable access to services for all clients, regardless of background? A. Beneficence. B. Integrity. C. Justice. D. Fidelity. Answer: C. Justice. This question asks about the ethical principle related to fairness and access. Justice in the ethical code means advocating for fairness and equitable access to services for all individuals who need them, regardless of their background, race, ethnicity, socioeconomic status, disability, etc. Beneficence is doing good. Integrity is honesty. Fidelity is trustworthiness. Working to ensure fair treatment and access to effective services is practicing justice. Question 44. You are asked to implement a procedure where, contingent on a challenging behavior, the client is required to perform an effortful task that is directly related to the problem behavior example, writing, "I will keep my hands to myself 10 times after hitting." This is an example of A. Response cost. B. Timeout. C. Positive practice overcorrection. D. Restitutional overcorrection. Answer: C. Positive practice overcorrection. This question describes positive practice overcorrection, a form of positive punishment. Overcorrection requires the individual to perform effortful behavior after a problem behavior. Positive practice requires the individual to repeatedly practice an appropriate behavior that is incompatible with or a replacement for the problem behavior, often to an exaggerated extent, example, repeatedly practicing keeping hands down or writing sentences. Response cost removes a reinforcer. Timeout removes access to reinforcement. Restitutional overcorrection involves restoring the environment to a state better than it was before the problem behavior. Repeatedly practicing a desired behavior is positive practice overcorrection. Question 45. A client consistently engages in hand flapping only when they are alone and not engaged in any other activity. This suggests the function is most likely. A. Attention. B. Escape. C. Access to tangibles. D. Automatic reinforcement. Answer: D. Automatic reinforcement. This question asks about function based on limited information. The clue is that the behavior occurs when the client is alone and not engaged in any other activity, suggesting the behavior is not being maintained by social attention, escape from demands, or getting external items. If the behavior happens regardless of the presence of others or external consequences, it points towards the behavior itself providing the reinforcement, such as sensory input or an internal feeling. This is automatic reinforcement. Question 46. When collecting data using a paired stimulus preference assessment, forced choice, how many items are presented to the client at one time during each trial? A. 1. D. 2. C. 3. D. As many as you have available. Answer: B. 2. This question asks about the specific procedure of a paired stimulus assessment. In a paired stimulus assessment, forced choice, items are presented to the client in pairs. The client chooses one from the pair, and that is recorded. This is done for every possible combination of pairs from the set of preferred items. Free operand presents multiple items freely. MSWO/MSW present multiple items, usually 3 or more, in a lineup. Presenting items in sets of exactly 2 is the defining characteristic of a paired stimulus assessment. Question 47. According to the RBT Ethics Code, you should report accurately and honestly to your supervisor regarding A. Only client behaviors that have decreased. B. Only client behaviors that have increased. C. All client behaviors and program data as directed by your supervisor. D. Your interpretation of why a behavior is occurring. Answer: C. All client behaviors and program data as directed by your supervisor. This question is about accurate and comprehensive reporting. You have an ethical responsibility to report all data and observations as directed by your supervisor, regardless of whether the client is making progress. B. Your reports should be accurate and objective, reflecting what happened. While you might have ideas about function, determining the function. D is the supervisor's role, and your report should focus on objective data and observations, not your interpretation, unless you are trained to do so and instructed by your supervisor. Report all the data as requested, good or bad. Question 48. When fading a physical prompt during teaching, you would gradually reduce A. The physical guidance you provide. B. The distance between you and the client. C. The size of the stimulus. D. The frequency of reinforcement. Answer A. The physical guidance you provide. This question asks what is changed during physical prompt fading. A physical prompt involves using physical contact or guidance to help the client perform a behavior. Fading this prompt means gradually reducing the amount of physical assistance you give, moving from full physical guidance to partial guidance, then perhaps a light touch, and eventually no physical help at all. Reducing distance, B, or stimulus size, C, are types of stimulus fading. Reducing reinforcement frequency. D is thinning a reinforcement schedule, not prompt fading. Reducing physical help is physical prompt fading. Question 49. Which type of measurement involves recording whether a behavior occurred at any point during a specific interval? A. Whole interval recording. B. Momentary time sampling. C. Partial interval recording. D. Frequency recording. Answer C. Partial interval recording. This question retests partial interval recording. In partial interval recording, you divide the observation period into intervals and record if the behavior happened at any point within that interval, even if it was very brief. Whole interval requires it throughout. Momentary time sampling checks only at the end. Frequency counts every instance. At any point is the key for partial interval recording. Question 50. According to the RBT ethics code, if a client's parent wants to talk about sensitive client information in a public place, like a waiting room, you should A. Engage in the conversation as they are the parent. B. Listen quietly but do not participate. C. Politely inform them that this is not an appropriate place to discuss confidential information and offer to talk in a private setting, or schedule a time with your supervisor. D. Tell them you cannot talk about the client at all. Answer C. Politely inform them that this is not an appropriate place to discuss confidential information and offer to talk in a private setting, or schedule a time with your supervisor. This question is about maintaining confidentiality in a practical scenario. Discussing confidential client information in a public or semi-public place is a breach of confidentiality. You should politely but firmly guide the parent to understand the need for privacy. Inform them that the current location is not appropriate for discussing sensitive information and offer alternatives for a private conversation, or suggest scheduling a time with your supervisor. Engaging in the conversation, B, or refusing to talk at all, D, are inappropriate. Protect confidentiality by guiding the conversation to a private setting. Question 51. A child screams when presented with challenging academic tasks. A functional analysis confirms the screaming is maintained by escape. Which intervention is likely to be the most effective and ethical first step in addressing this behavior? A. Implement a timeout procedure every time the child screams. B. Put the screaming on extinction by ignoring it. C. Implement positive practice overcorrection for screaming. D. Modify the task to be less challenging and reinforce attempts or completion. Answer D. Modify the task to be less challenging and reinforce attempts or completion. This question asks for an effective and ethical first step, considering the function and principles of intervention. If the behavior is escape maintained, making the task less aversive. Modifying the task difficulty, and reinforcing engagement or completion. Reinforcement is an antecedent intervention that addresses the root cause. The task is too hard/aversive and builds desired behavior before the problem behavior occurs. Punishment procedures like timeout, A, or overcorrection, C, are more restrictive and usually considered after less intrusive methods. Extinction, B, can be difficult with escape and doesn't teach a replacement. Addressing the antecedent, task difficulty, and reinforcing appropriate behavior is often the most effective and ethical first approach for escape behaviors. Question 52. When reinforcing a behavior on a schedule where reinforcement is delivered for the first response after a variable, unpredictable amount of time has passed, averaging out to a specific duration, this is A, fixed ratio, FR, schedule, B, variable ratio, VR, schedule, C, fixed interval, FI, schedule, D, variable interval, VI, schedule. Answer D, variable interval, VI, schedule. This question retests the definition of a VI schedule. A variable interval, VI, schedule delivers reinforcement for the first response after a period of time, but the length of that time period varies from trial to trial. Averaging a specific duration example, VI 15 minutes, means reinforcement is available on average every 15 minutes. Variable means unpredictable time, interval means based on time. Fixed interval, FI, uses fixed time, ratio schedules. FR, VR, are based on responses. Unpredictable time for reinforcement is VI. Question 53. A stimulus that signals that a specific behavior will not be reinforced is called an A. Discriminative stimulus, SDE. B. Motivating operation, MO. C. Conditioned stimulus, CS. D. S delta, SD. Answer D. S delta, SD. This question asks about a stimulus that signals the absence of reinforcement. An S delta, SD, is a stimulus in the presence of which a particular behavior has been extinguished or not reinforced in the past. It signals that performing that behavior now is unlikely to lead to reinforcement. A discriminative stimulus, SDE, signals reinforcement is available. In MO changes reinforcer value. A CS is from classical conditioning. The S delta is the cue that tells you the behavior won't pay off right now. Question 54. According to the RBT ethics code, maintaining competence involves A. Attending every scheduled team meeting. B. Only working with clients you have worked with before. C. Practicing only within your defined RBT role and seeking training and supervision for new tasks. D. Reading professional journals regularly on your own. Answer C. Practicing only within your defined RBT role and seeking training and supervision for new tasks. This question asks about maintaining your skills and knowledge as an RBT. The principle of maintaining competence requires that you only work within your defined role and scope of practice as an RBT. This means you should not perform tasks that require the expertise of a BCBA. It also means you must seek appropriate training and supervision whenever you are asked to implement a new procedure or work in a new situation that is outside your current training. Attending meetings, A, and reading journals, D, can contribute but don't fully define competence maintenance. Only working with familiar clients, B, would limit your growth and ability to serve others. Staying within your scope and seeking training is crucial. Question 55. You are teaching a client to put their socks on. You have a task analysis with 4 steps. You teach the last step. Pull sock all the way up first, prompting through steps 1 to 3, and reinforce when they do step 4 independently. Then you teach steps 3, put sock over heel, and 4 independently, reinforcing completion of both, and so on. This is A. Forward chaining, B. Backward chaining, C. Total task presentation, D. Shaping. Answer B. Backward chaining. This question retests backward chaining with a new example. In backward chaining, you teach the steps of a task analysis starting with the last step. The therapist prompts the client through all preceding steps, and the client performs the final step independently to earn reinforcement. Once the last step is mastered, you teach the second to last step and have the client complete the last step immediately after, reinforcing the completion of the last two steps. You move backward through the chain, teaching the steps from the end to the beginning. Teaching the last step first is the key. Question 56. What is the primary purpose of using a task analysis? A. To determine the function of a behavior. B. To identify potential reinforcers. C. To break down a complex skill into smaller teachable steps. D. To measure the frequency of a behavior. Answer C. To break down a complex skill into smaller teachable steps. This question asks about the purpose of a task analysis. A task analysis is the process of taking a complex skill, like getting dressed, making a snack, or completing a chore, and breaking it down into a list of individual, smaller, more manageable steps. This makes the skill easier to teach and learn. Functional analysis. A. Finds function. Preference assessment. B. Finds reinforcers. Measuring. D. Is done after the task analysis is created and steps are taught. Breaking a skill into its component parts is the purpose of a task analysis. Question 57. You are collecting data on a client screaming using whole interval recording with 1-minute intervals. The client screams continuously for the entire 1-minute interval. How do you record this interval? A. Mark the interval as occurring. B. Do not mark the interval. C. Record the duration, 1 minute. D. Record the frequency, 1 instance. Answer A. Mark the interval as occurring. This question retests whole interval recording. In whole interval recording, you mark the interval as occurring only if the behavior is present continuously throughout the entire duration of the interval. Since the client screamed continuously for the whole minute, it meets the criterion, and you mark the interval. Not marking it, B, would be incorrect. Duration, C, and frequency. D are different measurement methods, not what you record in whole interval recording. If the behavior filled the whole box, you mark it. Question 58. Which ethical principle requires RBTs to accurately represent their training, experience, and role? A. Beneficence. B. Integrity. C. Justice. D. Professionalism. Answer B. Integrity. This question asks about the ethical principle related to honesty and accuracy in professional representation. Integrity means being truthful and honest in all aspects of your professional conduct, including accurately representing your qualifications, training, experience, and your defined role as an RBT. You should not exaggerate your skills or claim to be qualified for tasks you are not. Beneficence is doing good. Justice is fairness. Professionalism is a broad category. Being truthful about your professional identity falls under integrity. Question 59. When collecting data on how often a behavior occurs, you are measuring A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer B. Frequency. This question is a basic review of frequency measurement. Frequency, or count, is simply how many times a behavior occurs within a given observation period. Duration is how long it lasts. Latency is the time to start. IRT is the time between instances. Counting the number of times you see the behavior is frequency. Question 60. According to the RBT Ethics Code, if you are unsure about the function of a client's challenging behavior, you should A. Assume the function is attention and implement extinction. B. Assume the function is escape and implement a break procedure. C. Collect ABC data and discuss it with your supervisor. D. Implement a punishment procedure to quickly reduce the behavior. Answer: C. Collect ABC data and discuss it with your supervisor. This question addresses determining behavior function, which is a BCBA responsibility informed by RBT data. As an RBT, you do not independently determine the function of a behavior, a BD. Your role in this process is to collect objective data as directed by your supervisor, typically using methods like ABC recording. You then report this data and any observations to your supervisor, who will analyze it to determine the function and design the intervention. Collecting ABC data and reporting to your supervisor is the appropriate action when trying to understand why a behavior is happening. Question 61. Which ethical principle requires RBTs to respect clients' right to privacy and confidentiality? A. Beneficence. B. Fidelity. C. Justice. D. Respecting autonomy, often included under responsibility to clients. Answer: D. Respecting autonomy, often included under responsibility to clients. This question asks about respecting client rights, which is often encompassed within the broader principle of responsibility to clients and includes respecting autonomy, dignity, and privacy. Respecting the client's right to privacy and maintaining the confidentiality of their information is a key aspect of honoring their autonomy and treating them with dignity. While fidelity relates to trustworthiness and confidentiality is part of that, respecting the client's right to privacy aligns most directly with respecting their autonomy and overall welfare. Question 62. When teaching a client to make a snack, you teach the first step, get ingredients, until mastered, then teach the first two steps, get ingredients, get bowl, and reinforce, and so on. This is A. Backward chaining. B. Total task presentation. C. Forward chaining. D. Shaping. Answer: C. Forward chaining. This question retests forward chaining with a new example. In forward chaining, you teach the steps of a task analysis, starting with the first step. Once the first step is mastered, you teach the first two steps, reinforcing completion of that sequence. You continue adding steps from the beginning until the client completes the entire chain. Backward chaining starts from the end. Total task presents all steps in each trial. Shaping teaches a single behavior. Teaching from the beginning of the steps list is forward chaining. Question 63. What type of verbal behavior involves repeating exactly what someone else says? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer: C. Echoic. This question retests the definition of an echoic. An echoic is a verbal response where the speaker repeats the verbal behavior of another person with point-to-point correspondence, saying exactly what was hearty. Mands ask for things. Tacts label things. Intraverbals are conversational responses. Simply repeating sounds or words you hear is emitting an echoic. Question 64. When collecting data using momentary time sampling, you record whether the behavior occurs. A. At any point during the interval. B. Throughout the entire interval. C. Exactly at the end of the interval. D. Immediately before the interval begins. Answer: C. Exactly at the end of the interval. This question retests momentary time sampling. In momentary time sampling, you check for the behavior and record whether it is occurring only at the specific moment the observation interval concludes, when your timer beeps. Partial interval records any occurrence. A. Whole interval requires it throughout. B. Checking at the end is the key. Question 65. According to the RBT Ethics Code, if you are mandated to report suspected abuse or neglect, you should: A. First ensure you have definitive proof. B. Report it immediately to your supervisor and necessary authorities as required by law and agency policy. C. Discuss your suspicions with the client's family before reporting. D. Wait until your next scheduled supervision meeting to report. Answer: B. Report it immediately to your supervisor and necessary authorities as required by law and agency policy. This question is about mandatory reporting responsibilities. As a mandated reporter, you are legally and ethically required to report suspected abuse or neglect immediately upon becoming aware of it. You do not need definitive proof. A. Only a reasonable suspicion. You must report through the proper channels, which involves informing your supervisor and contacting the relevant authorities, like Child Protective Services or Adult Protective Services. According to law and agency policy, discussing with the family before reporting, C, or delaying the report, D, can put the client at further risk and violate reporting laws. Report suspected abuse immediately through the designated channels. Question 66. When a behavior is followed immediately by the presentation of a stimulus, and as a result, the behavior happens more often in the future, this is called A. Negative reinforcement. B. Positive punishment. C. Positive reinforcement. D. Extinction. Answer: C. Positive reinforcement. This question retests positive reinforcement. The keywords are presentation of a stimulus, add a D, and the behavior happening more often. Increases, adding something after a behavior that makes it more likely to happen again is positive reinforcement. Question 67. When a behavior is followed immediately by the removal of a stimulus, and as a result, the behavior happens more often in the future, this is called A. Positive punishment. B. Negative reinforcement. C. Positive reinforcement. D. Extinction. Answer: B. Negative reinforcement. This question retests negative reinforcement. The keywords are removal of a stimulus, taken away, and the behavior happening more often. Increases, taking something unpleasant away after a behavior that makes it more likely to happen again is negative reinforcement. Question 68. When a behavior is followed immediately by the presentation of a stimulus, and as a result, the behavior happens less often in the future, this is called A. Negative reinforcement. B. Positive punishment. C. Positive reinforcement. D. Extinction. Answer: B. Positive punishment. This question retests positive punishment. The keywords are presentation of a stimulus, add a D, and the behavior happening less often, decreases. Adding something unpleasant after a behavior that makes it less likely to happen again is positive punishment. Question 69. When a behavior is followed immediately by the removal of a stimulus, and as a result, the behavior happens less often in the future, this is called A. Positive punishment. B. Negative reinforcement. C. Negative punishment. D. Extinction. Answer: C. Negative punishment. This question retests negative punishment. The keywords are removal of a stimulus, taken away, and the behavior happening less often, decreases, taking something the person likes away after a behavior that makes it less likely to happen again is negative punishment. Question 70. When a behavior that was previously reinforced is no longer followed by reinforcement, and as a result, the behavior happens less often in the future, this procedure is called A. Punishment. B. Negative reinforcement. C. Positive reinforcement. D. Extinction. Answer: D. Extinction. This question retests extinction. Extinction is the procedure where reinforcement that used to follow a behavior is consistently withheld, resulting in the behavior decreasing over time. Question 71. An event that happens before a behavior occurs is called an A. Consequence. B. Antecedent. C. Response. D. Reinforcer. Answer B. Antecedent. This question retests the antecedent. In the ABC model, the antecedent is what comes immediately before the behavior. Question 72. An event that happens after a behavior occurs is called in A. Antecedent. B. Stimulus. C. Consequence. D. Prompt. Answer C. Consequence. This question retests the consequence. In the ABC model, the consequence is what comes immediately after the behavior. Question 73. The time between a stimulus, like an instruction, and the start of a behavior is called A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer C. Latency. This question retests latency measurement. Latency is the time from a stimulus to the beginning of the behavior. Question 74. Which dimension of behavior refers to the total amount of time a behavior occurs from start to finish? A. Frequency. B. Duration. C. Latency. D. Count. Answer B. Duration. This question retests duration measurement. Duration is how long a behavior lasts. Question 75. When you collect data by counting the number of times a behavior occurs in a specific time period, you are using A. Duration recording. B. Frequency recording. C. Latency recording. D. Interval recording. Answer B. Frequency recording. This question retests frequency measurement. Counting the number of times a behavior happens is frequency.